So thank you very much to have accepted this invitation. So you're working for Healthcare Without Harm, and today we're specifically going to talk about plastic in the healthcare sector, and you are specifically trained to train hospital facilities in that regard. So really happy to have you on board today. I think you have prepared something quite interactive with the public. It's possible that we have problem with the sound, so I might just transfer the questions to you, but I'll leave you the words. I think you have slides to share with us. Excellent.
Yes, hello. Can you please confirm that you can see the slides?
Perfect.
Great, thank you. It's not going to be super interactive, so no worries. I will try to keep it calm and maybe engage with you a little bit, at least, to pretend that we are in the same room, at least a little bit. I really miss that moment, being in the same audience. So, our topic today, I'm the third part of your seminars with measuring and reducing plastics in healthcare. And a few words about myself. I'm Anastasiia Martynenko, or Anastasiia, if you want to pronounce it in a way that it was meant to. I work for Healthcare Without Harm Europe as a circular economy research and training coordinator, which means I do research and also I organize and deliver trainings, taking into account the educational psychology and how the brain works and learns. And our organization, Healthcare Without Harm, has three main programs. There is a group of people working to create climate smart healthcare. I'm on the team of circular healthcare, and we have also a team of people working on safer pharma. And as we talk about plastics today, so I'm the right person to present you our findings and how we work. We have main 5 projects ongoing at the moment. We have lots of projects that already finished and many projects in mind, and you can read more about it on our website. And Born Green Generation is a project, collaborative project. We work with hospitals around Europe and with universities, including one university in Switzerland. We're trying to create toxic-free healthcare, especially for babies and children up until 2.5 years old. Another project is PVC-free. We're piloting with German hospitals reduction of PVC medical devices and reduction of toxicity in their hospitals. Another project, which is global, not only European, is Reusable Medical Textile Revolution. It's about to finish soon, so we conducted some audits and helped some hospitals around the world to transfer from single-use medical textiles to reusable ones. There is collaborative project Procure for Health, which is also global. We're trying to change procurement procedures into more sustainable ones. And after the single-use project, where I'm involved also a lot, it's a global project where we're trying to understand anthropological reasons. How did we come to where we are now? And why do we use so much single-use in healthcare? And how can we find our way out of this? And we collaborate with research institutes in many countries around the world. So this is, in few words, what we do as an organization. And today's presentation is based on the toolkit that we have developed. It's called Measuring and Reducing Plastics in the Healthcare Sector. I will leave the link here on the slide, and also other links you will find on the slides. You can follow later and get more information if you want to. And it's available, by the way, not only in English. If you're more comfortable in reading in any other languages like French or any other, you can also check it out on the website. So, very short, the impact of plastics. I know that you already had 2 seminars about how plastic impacts your health, but maybe I can engage with the audience here just for a minute. In a few words, what do you remember and how do you understand plastic impacts our health? You can type in the chat or you can unmute if that's possible technically, or maybe someone in the audience can help.
I'm not sure we can unmute everyone, but at least
Okay.
if I can try to report the question. Sorry for the bad connection.
I hope I will see if someone will type in the chat. I will ask again. So what is the issue? Oh yeah, micro body fluids. Okay, yeah, that's one of the ways how plastic impacts our health. What else? What do you remember or know already?
Okay. There is a few answers in the room. So endocrine consequences, cancer.
Yes, risks not well understood. Yeah, I see another answer in the chat. Thank you. Any other
Fertility.
answer?
Yes.
Excuse me.
Fertility.
Fertility. Okay. Yes. Yeah. Thank you. Endocrine disrupting chemicals that are found in plastics. Thank you.
Maybe neurodevelopment.
Yeah. Thank you. So all of these replies are absolutely take place. Bioaccumulation, yes, yeah. And also, as someone summed up already, it's not completely researched and absolutely known how plastic impacts our health, but there is a lot of research done already to know that it is very harmful to our health. Respiratory issues, unknown cocktail effects. Thank you. I will just, to sum it up, I want to bring up a wider picture of how plastic impacts our health. So it doesn't impact only when we use it or only when we throw it away. It's a much, much wider picture. So when we extract oil and gas in order to produce plastics and to create chemicals that are in plastics, then there is lots of impact already during extraction of oil and gas. There is air pollution occurring, soil pollution, water pollution. Lots of chemicals are released. For example, in order to extract gas from the shell through fracking, which is a very popular way to extract gas from gas shells, lots and lots of water polluted with chemicals gets into our waterways. And also it gets into the soil. So especially on this stage of plastic production, local communities are getting affected the most. And then we have transportation impacts, which of course we know it's also CO2 emissions and methane emissions. And then we have refining and manufacturing, which means that we manufacture first the material, and then we produce or manufacture the product itself. So on each of those stages in each of the facilities, there is lots of emissions and air pollution and water pollution and soil pollution. And again, especially communities who live near these places, they get affected the most. And then we have the product use. So in the case of healthcare, the patients use the product either intentionally or it's just been used on them. And then all the chemicals that are in plastics, they get into their system, into their health through breathing, through intravenous system, through skin contact, food contact materials, and so on. So this is another way how plastic can impact us, another stage of its life cycle. And then, of course, there is product disposal, which means that we don't need it anymore and we're ready to get rid of it. And here it can go to the landfill or to the environment, which I believe doesn't often happen in the Switzerland, but in the world it does. And many countries from the European Union send their waste to other countries, which is called waste export, in order to be recycled, but actually just dumped or burned in other countries, which means it's water pollution, air pollution, soil pollution, again, communities. And then another option would be incineration, which I believe happens also in Switzerland. It means there's lots of emissions, especially CO2 emissions, and lots of toxic ash is being created. Up to 30% of incineration of waste getting into incinerator becomes ash, and you need to do something with the super toxic residuals. And again, communities around the incinerators, they suffer a lot. And the third way that usually happens to waste is recycling. And recycling is not always a viable option, because sometimes it's technically impossible because how products are designed, we just can't recycle them. And sometimes it's also not possible to collect them separately, or economically, it's not interesting to do the recycling process of these products. So as a result, we have all of this life cycle of plastics, and on each of the stages, it impacts health of people and environment. So usually we're more concentrating on the last stage, what do we do with waste? And now, since recently, we started to talk about how to reduce the impact during the use. But it's important not to forget that there are other stages that are also impacting our health, as we live all on the same planet and all the water and air systems are interconnected that much. So just to keep in mind the picture that plastic has a big impact. And now let's discuss how to reduce the impact of plastics and the use of plastics in the healthcare. First of all, it's important to understand that it's really difficult to quantify and to understand how much plastic is used. We know that it's more than it was before the COVID-19, but it's not exactly clear how much, like in numbers. It's really difficult to quantify it. But there are some ways to do it, and we're working on it. So in order to reduce the amount of plastics, we need to first of all to understand what is it that we use? Like, what is plastics in the healthcare? And there are some ways to do it. And again, I'd like to ask the audience, how would you identify the plastics in the healthcare facility? What would you do? How would you find out? You can throw any ideas again in the chat, or maybe Alain can help with the audience. Check the garbage. Thank you, Manuel.
How much and which type of plastic?
So there is a comment here, try to estimate for one patient the different kind and the amount of plastic which is used. And by that, we can estimate the overall use of plastic in the hospital.
Thank you. Yeah, and I can see in the chat also, Emmanuel, identify plastic packaging at reception.
Also the
Any other ideas?
get order store. Keep order.
So there's also a comment about ordering. So to look at the everything that has been bought in the hospital, or to look at the
Thank you.
list.
Yeah, and I can see in the chat also similar, the purchasing department ask suppliers to provide info on plastics used. Thank you. Yeah, that's all the main ways how you can identify the plastics. I mean, the most obvious one is to observe and just to see around where is it used and which items are plastics. And we concentrate usually in our work in Healthcare Without Harm with hospitals and other healthcare facilities. First of all, on waste audit, to identify what is being thrown away. And second of all, on procurement audit, you named both of those options to identify what is being bought and how we can change procurement practices and buy different things. So we have collected in our projects some data with hospitals. With the waste audit, there's lots of information, and it's an interesting process in general. In case you will want to do it one day, it's really exciting to do waste audit, even at home. But in the healthcare facility, you can find out lots of information that that you might have not known how you deal with waste and what you actually throw away, and what is the quantities of that, and how you can reduce that as well. So we have our waste audit tool on our website. When you have time, I will leave you a link here, and you can see how to collect data. And also in the toolkit, which you have a link to as well, there is very clear steps. How do you create a team to do the waste audit? What do you need? Like, which supplies do you need? What do you need to wear? And how to divide the roles, what to look at, how to take precaution and be careful, because of course it's medical waste, but with any waste you have to be careful. So waste audit will give us lots of data on what's been thrown away. And according to the waste audit that our partner hospitals have conducted, we realized that about from 25 to 50% of waste is usually plastics. It depends very much on the facility. And about the procurement audit, it's more clean, and it's you can do it in a cleaner environment and just even sitting at your table at your computer. And you can actually do both in order to have more data to work on. The procurement audit that we have conducted with our partner hospitals, we identified the medical items, then some critical medical devices that come in contact with the system, with body, and other sterile tissues, and some non-medical items. So if we take into account the medical items, the data that we have identified through procurement audit was that one single item that in all the hospitals was the main item and had the most percentage of waste, but was disposable gloves. It was like 17.5% of all the waste, of all the medical item waste. The other one was IV solution bags and disposable protective clothing, which could be easily replaced with reusable one, and then we'll come to this solution in a bit. Syringes, intravenous administration systems, and some other products like nappies and continuing wear and so on. So about non-medical items. Oh, sorry, I have a little picture here. What do you think are the non-medical items that are in the waste that we can identify through either waste audit or procurement audit? Packaging, yeah, thank you. That's on the picture. Glasses. Mm-hmm. By glasses, you probably mean cups, drink cups, if I understand it right, yeah? Coffee cups. Mm-hmm. Yep, okay. Any other ideas? What could be non-medical items? Water bottles. Mm-hmm.
Baby bottles as well.
Baby bottles, yeah. Yeah, that's pretty much all the items that we see. So we call them food contact materials, basically anything that contacts with your food and drinks. And it could be cups, cutleries, any sort of sachets, water bottles, or any other drink bottles. Then it's a patient care. So it's some medicine pots. So the little pots that you drink medicine from. The wipe and cleaning cloths, not the sterile ones, but the general ones. inconvenience products, so it could be nappies, it could be this sort of things. Packaging, lots of packaging, because many of the medical items come in the packaging, and the packaging itself is not necessarily medical packaging, and it definitely could be reduced either in size or in quantity, and some others like plastic bags, little toys, and so on. So these all are non-medical items and there are ways to reduce those as well. And it's not, in most of the cases, there is no necessity to use those. So what next? We have conducted our waste audit or procurement audit, or both of them. We understood how much plastics we have, how much we use, and what exactly it is. And then we need to create an action plan. For action plan, there is again lots of steps in the tutorial that you could read and take the steps. I just want to stop on 3 most important things. First of all, sustainable procurement. So it's important to develop a plan and a policy for sustainable procurement. Secondly, apply the waste hierarchy, and we'll come back to it in a minute. And communication. Communication is always the key. So sustainable procurement, when you're trying to change your procurement, it's important to adapt the sustainable procurement criteria, and we have developed lots of resources that could be helpful for you in the future. And this will help you to identify better suppliers and also to communicate with your suppliers. So when you ask your suppliers about the manufacturing process, how is the product being manufactured? Where do they take resources from? What are the working conditions of the people? Does it have any chemicals that are on the phase out list, for example? And all of these materials we also have and provide. Basically, you need to start educating yourself on how to identify a better product, and inevitably educating your suppliers on how they should switch to a more sustainable product and more responsible product. And as soon as they see that you care, you as a healthcare professional or as a facility or even as a group of facilities, you care and you'd like to have a better alternative, then they will start changing their practices, because at the moment they're not much limited and they can put almost any chemicals in their products, and they don't even have to write down the contents of it or identify the plastic type sometimes. And another step that you could take with sustainable procurement, which is very, very powerful, is to collaborate with other hospitals. So we had an example in Sweden where a group of hospitals collaborated together and developed the better criteria for more sustainable procurement of the single-use syringes. And the product wasn't on the market actually, but they decided how they want the product to look like, contacted the producers, and they manufactured a new product for them because the demand was big enough for them to change their manufacturing practices. So this is also how this could work. So here will be the list of resources for you. You can later have a look on how to develop better procurement criteria, and also what is the phase-out list of the chemicals. So the next step would be apply the waste hierarchy. We don't have much time to discuss all of the items, but I would like to go through the main ones. So the ones on top, if you haven't seen hierarchy before, the ones on top are the most important and the ones that you should apply the most, and make a preference always. So if you have an item that you're using, first what you should ask yourself, like, can I refuse from it? And then if you can't, then can I reduce it? Can I reduce the number of it, or the volume, or the weight, or the quantity? And then the next question would be, can I reuse it, or can I repair it? And first 3 steps are always preferred. This is where prevention is happening. So you're preventing waste from being created because you're changing some practices. And after that, the waste is already created. So after that, you're dealing with waste. You're trying to separate it in order to be recycled, or to recover some materials from it, or to dispose of it. So let's go into the main steps. Refuse. When we say refuse, first we should ask ourselves, is this item really needed? For example, in one hospital in the United States, there were these pre-made kits for tonsil surgery, and they included 12 unnecessary single-use items out of 40. So by conducting the audit and understanding that actually these 12 items almost never get used, they managed to communicate with the suppliers and to change this kit and to take away these 12 unnecessary items, and just to have them in case they are needed on the side. And thanks to that, they reduced the cost from $77 to $66 per pack, which I'd say per year would be thousands and thousands of dollars. And there's lots of cases of this sort of kits work in the European Union as well. Then the next step would be reduce. And the question you're asking yourself is, oh, sorry, that's not the question. The question is, can I somehow reduce something that is not necessary? For example, we had a gloves off campaign in the UK. The hospital in the UK, Great Ormond Street Hospital. It's our partner in many projects. And they reduced, by communicating with their staff, they reduce annual use of gloves by 4.3 million, and the waste was reduced by 21 tons per year, and they saved, financial savings is always a good argument, they saved almost 120 euros after 1 year through this gloves off campaign, only in one hospital. And they achieved it by educating the staff when they should use gloves and when they shouldn't use gloves, and also how to do good hand hygiene practices. And why is it important? Because very often hand hygiene is neglected because healthcare professionals are using gloves, and very often non-sterile gloves. And this is why they don't actually wash hands properly. And basically they're not preventing waste, but the opposite thing happens. So by using gloves more smart and only when necessary, you can actually prevent health problems in the healthcare staff, because like the skin diseases and everything else connected to constant wearing of gloves, and you can save money, save costs, and reduce waste. So yeah, there should be a picture coming here. I think the presentation is stuck. Yes, that's the picture. That's the picture from the audit, how they were analyzing the gloves that they were using. And as you know, there's different materials they're made of. It could be PVC, it could be nitrile, and so on, and they're not the same. And there's lots of health hazards, for example, from PVC material. But that's another question. So we're applying our waste hierarchy here. We refused what we could refuse. Then we reduced the use of something that is not necessary, or when it is not necessary. What's the next step? We can reuse something that we have. If there are alternatives to something single use that we can replace and it's non-toxic, then it's always better to reuse. It could improve resilience. What I mean by this is COVID-19 showed that we faced with very limited supplies of single-use items because we needed a lot of them at one point. So by having reusables and having
think we have lost Anastasiia. I think she will come back.
Thank you. Yeah, I was trying to join from mobile internet, but couldn't do that either. I don't know. Let's say I'm back and we have some time left and we have time for questions, but you can also interrupt me anytime if you have a question. And there's just a few slides left. So where did we stop? We were talking about waste hierarchy, share, and slideshow. And we discussed that it's always good, when possible, to refuse from unnecessary items, reduce the use of those that could be reduced. And now we're reusing. So we're reusing something that we have and we can't refuse and reduce. What could be reused? Maybe I can ask you, what can we reuse from the single-use items? Or what can we replace? Which single-use items we can replace with reusables?
Je pense qu'on a de nouveau perdu. Je crois qu'on va vraiment s'arrêter là pour aujourd'hui, d'autant plus qu'on a des problèmes pour vous avoir dans les conversations. Je suis désolé pour les personnes qui sont en ligne. C'est extrêmement difficile de pouvoir continuer, je pense, les conversations dans ces conditions. Je ne sais pas ce que vous en pensez, mais je crois qu'on va s'arrêter là pour aujourd'hui. À moins qu'il y ait des gens en ligne qui aimeraient dire quelque chose. Évidemment, on va vous envoyer, il y a un chat en ligne. Évidemment, on va récupérer toutes ces informations-là, on va vous les transmettre. Je ne sais pas vraiment où était le problème. J'ai l'impression qu'on avait plusieurs problèmes aujourd'hui. Il y avait des problèmes dans notre système, mais aussi des problèmes chez elle par rapport au fait qu'elle se fasse éjecter. Mais on va rendre disponible tout ce matériel pour que les gens puissent au moins s'en servir. Vu que malgré tout, il nous reste du temps, je ne sais pas si une personne qui est en ligne ou bien une personne ici aimerait annoncer quelque chose ou bien parler d'une expérience personnelle. Si ce n'est pas le cas, je crois qu'on va vraiment s'arrêter là. La prochaine fois, ce sera plus simple parce que ce sera en vrai. Alors, vous pouvez aussi regarder en ligne, ce sera toujours le cas. Alors, on va parler de phtalates, on va parler de choses très pratiques dans le système de santé. Ce sera Pierre Decker au Bunion 19. Donc, c'est de l'autre côté de la rue, mais c'est toujours sur la cité universitaire. Tout est sur le site internet. Donc là, venez, vous pouvez venir tout à fait nombreux sur place. Il y aura tout ce qu'il faut. Et les chanceux et les chanceuses qui sont sur place, il y a en général du café et des friandises. Ça marche parce que c'est pas du virtuel, c'est du vrai. Encore navré pour les personnes qui sont en ligne. C'était extrêmement difficile de suivre la conversation comme ça.